Good afternoon. I'm Tyler Escobar, and this is Germany, a brief analysis of German health status. Today we're going to cover where Germany is at in relation to Western Europe. We're going to talk a little bit about affluence versus poverty, German health systems, German health status, some advancements that Germany has made over the past 40 years, how Germany compares to a peripheral country, what lies ahead for Germany, some advantages and barriers that Germany faces, as well as public health priorities for the future. So where is Germany? Here's a map of Western Europe, and you can see that Germany is here in orange, with France, Belgium, Switzerland, and Austria as peripheral countries. And a little bit closer look at Germany. Germany is a mature federal parliamentary republic with 16 federal states, and this graph here, this map rather, shows the 16 federal states within Germany. So what kind of country is Germany? Well, it's the fourth largest economy in the world. It has a total population of above 81 million, annual GDP per capita of above 41,000. Germany spends about 8.7% of its public expenditures on health, which is 0.2% higher than the US and quite a bit higher than Switzerland at 7.1%. The unemployment rate is relatively low in Germany at 5.5%, and it's about 3% less than the US, which is a pretty stark comparison. German literacy rates are at 99%, which is really good. And also, about 80% of the population, the working population rather, in Germany, have at least a high school education, if not more, which is pretty good. So the life expectancy at birth, and this is a key component here, is about 80.8 years, and that's for males and females. So affluence or poverty. I've got two graphs here, and I'll briefly explain each one. So high GDP, this is Germany here, indicating that Germany has, since 1990, been growing in its GDP in relation to France, Italy, Japan, and Great Britain. And you can see the recession here, but Germany recovered very quickly from it, which is a testament to its affluent properties, as well as the low unemployment rate, which I've got a graph here of. So here's Germany's unemployment rate. It's going down, it's going down. Here we've got a recession here with a slight increase, but they recover quickly, which is in stark comparison to the OECD, which is the Organization for Economic Cooperation and Development line here, which is representative of an average of about 34 different countries. So that's a pretty significant graph in terms of unemployment status in Germany. So the verdict is that Germany is, of course, an affluent nation. German economy greatly affects peripheral countries, and it's not so much that Germany is large, which it is in terms of its square footage, but it's also very densely populated. And of course, with affluence comes certain health concerns. Now let's go into German health systems. So Germany has a national health system rather, which 90% of German citizens choose to use. The rich can of course opt out if they wish, and they can privately insure themselves. And the delivery of the health care is covered mostly by private physicians and facilities, which are of course funded privately, with a slight amount of their funding coming from taxes. Now, Germans use what they call sickness funds, which is what we would call health insurance companies. There's about 240 of them, a little over that, and they all cover health costs for German citizens with very low copays, about $15 for every 3 months. So how do they do it? Well, these sickness funds are paid through employers and employees, and they're based on income. So about 50% is paid by the employer, another 50% by the employee, and every premium is based off of income. A person that makes $30,000 a year is going to pay a lower premium than a person that makes $60,000 a year. And the biggest component here in German health systems is that insurance companies are not allowed to make a profit by federal mandate, which is absolutely paramount to their success. Federal regulations, of course, predetermine medical costs, so hospitals can't hike up costs, physicians can't raise their prices. Physicians are, of course, paid less because of this, but it's a necessary evil. Medications do cost less in Germany as well. So another key component about German health systems is that they have very, very rich health resources. They've got 8.3 hospital beds per 1,000 population, which is about third in the amount of hospital beds per 1,000 population that I've seen. The only countries that I've seen so far that have higher than that are Japan and Korea. They're very physician dense and they're very nurse dense with 3.8 physicians per 1,000 population and 11.4 practicing nurses per 1,000 population. So German health status. So they've got low infant, neonatal, and under 5 mortality rates, and contraceptive prevalence is high, fertility rates are low. And really this is indicative of better living standards, the low child mortality rates, and the greater access to perinatal care that women have, as well as just the general advancements that women have made in German society. All of these have led to the lower fertility rates and the lesser maternal mortality ratios. So, bottom line is Germans have good health in general. They have very low HIV/AIDS related deaths, and their health programs are very, very comprehensive. German health program is just as likely to cover something like going to the spa or other alternative medicines as it is to cover a shoulder surgery. They're very keen on homeopathic and alternative medicines. So how does Germany compare? So Germany's life expectancy is at, like I said, 80.8%, which is slightly above the OECD average, but lower than Switzerland at 82.8%. Switzerland has a slightly higher neonatal mortality rate, under 5 mortality rate, and infant mortality rate. And Switzerland has a higher HIV prevalence and a higher maternal mortality ratio. So the question then comes around is, so why do the Swiss live longer? Which I'm actually not able to answer, but it's a really, really good question. So health status advancements since 1970. So improvements have been made, and here's where I draw the improvements from. In 1970, the infant mortality rate was at 22, which was very high. 25.6 for under 5 mortality, and the fertility rate was 2, which was very, very high. And in 2010, the infant mortality rate has gone all the way down to 3.4, 4.1 for under 5, and fertility rate of 1.4. Everything has dropped, and everything has dropped dramatically. And it's important to note that these have been a steady decline. It's not something that happened overnight. These statistics didn't stay the same until 2005, and then all of a sudden in 2010 they were different. These have been a very steady decline. And the changes in the child mortality rates have been roughly equal, meaning that the infant mortality rates, neonatal mortality rates, they've all declined at roughly the same amount. One hasn't gone very far over the others. So what are the causes for these health advancements? Well, we've talked a little bit about advancements in women in German society, advancements in perinatal care, but also we've got living condition advancements, of course advancements in medical care, and that's global. Public health initiatives have gotten a whole lot greater, and health sector resources. We've talked about health sector resources being very rich, very physician rich, very nurse rich. Also, depreciations in smoking prevalence. So here I've got that smoking has decreased from 28.5% in 1978 to 21.9% in 2009 in Germany. Now 21.9% is around the average of the OECD, but it's still quite high in comparison to other countries like America, Sweden, Australia. It's still a whole lot higher. So what lies ahead for Germany? So Germany's population is aging at an alarming rate. More than 40% of the total population is made up of the very young and the very old. And you can see here 14 million people are below 15 in Germany, and 19.5 million people are above 65. So what does this do? Well, this creates a greater burden on the middle-aged workers. Now why is that? Because here's the middle-aged workers right here. Here's the under 15 right here. They make up quite a large proportion. And the above 65, which are right here, and those create quite a large proportion of the population as well. And what this means, and we'll see right here, is that there is less workers available to help fund the growing number of social service dependents. So that's pretty key right there. So, and of course, the burden is placed on the middle-aged workers, and the demand for long-term care services is going to rise. And by this I mean we're talking about home health care services, we're talking about hospice services, long-term rehabilitation facilities. The need for those facilities is going to rise dramatically with the aging population because there's going to be a greater amount of chronic diseases such as ischemic heart disease, which is a leading cause of morbidity in Germany, cerebral vascular disease, and cancer. So let's talk about some barriers. So on the humanitarian side, the fostering of migration is something that they can use to overcome the barrier of the aging workforce. And really, they need to foster migration of skilled workers, not just migration in general. So they get more skilled workers into the general population that can help to offset the aging workforce. So some of the environmental key components are they placed a ban on nuclear power, which I consider a barrier to advancement. And they can overcome this barrier by focusing on eco-innovation. Some of the research that I did proved that, or suggested that Germany has been a leader in eco-innovation in the past, but they've kind of fallen off the wagon in the past few years. So they need to become a leader in the future. So again, they've got the aging workforce. That's a central theme throughout. And they can help to offset this economically by raising the labor participation of females and of older workers. So what are the public health priorities? So they need to address the needs of an aging population. We talked about long-term care, the need for hospice, the need for rehabilitation, long-term rehabilitation facilities, home health care, some of those things. They also need to address rises in obesity and obesity-related diseases. And this is really a problem of affluence. Obesity is on the rise in Germany just as it is anywhere else, even though obesity numbers in Germany are quite a bit lower than in America. And third, addressing preventable diseases like lung cancer from smoking, cirrhosis from the liver. A study that I found that that Germans drink a whole lot more than surrounding nations. So cirrhosis of the liver would be a problem from that, and it's preventable. So to wrap it up, Germany is an affluent nation. We covered that. German health systems are proficient and well accepted. People really like German health systems. They really enjoy their country, and they really enjoy their country's way of dealing with health. So they enjoy a high level of health because of this, and they're aging. So health status has improved since 1970, but they still have a few barriers to overcome, and we talked about some of the barriers, some of the ways that they can overcome that. So the public health priorities in the future will focus on diseases on aging, affluent nation. Diseases of an aging, affluent nation, rather. And that's it, and I'll leave the rest of it open to questions.